Good afternoon, everybody. Welcome back to the Nursing Associate podcast. I'm with my fantastic team, Emma, Harriet, Terry and Alex. If you'd all like to say hello.
Hello.
Right, guys, what's today's topic? As this is podcast 2 of our second year, we are going to be talking about spoke days. This has nothing to do with spokes on a wheel. It's just a word used for going to work at other parts of the sort of the medical environment. It's a word you'll hear probably said in the first couple of weeks of potentially starting your placements. And what it refers to is that you can use your placement hours, i.e. the hours you need to accrue for that placement, and you can go and earn those hours in other parts of, let's say, the hospital or the community. You can do it in both adult health, paediatric health, and especially mental health. And it's an absolute amazing way of learning other parts of your environment. And it certainly makes everyone a lot more well-rounded in how the system works. So, who would like to start me off by giving me some benefits of doing a spoke day?
Having access to specialists.
In what sense?
Being able to go and see what a stoma nurse does, what a respiratory nurse does, and how they manage these chronic conditions.
So basically, instead of sort of getting like a bit of an overview that someone's got a stoma bag, you're actually going into the nitty-gritty of emptying them, reapplying them, why they've got them.
Absolutely, and the different types of stoma bags and the different ways of caring for them, and to be able to look at the whole person's medical history and see how it's managed differently to each person.
And obviously you can have stomas for different parts of your intestines,
Yes.
or the overall GI tract, so that they can all do weird and wonderful things. No, that's brilliant. And anybody else got some benefits from doing spoke days? Emma?
So I think that having a spoke day is a really good way to fill out your practice proficiencies when they're not available to you on your base ward or on your placement. Sometimes you're gonna have this list of proficiencies that you can't meet specific goals where you're placed, and actually booking spoke days is a fantastic way to get that out on paper.
Emma deserves the golden buzzer for probably the best benefit to doing a spoke day. You've hit the nail on the head. You know, for all of us, you'll have got these printed off sheets with your proficiencies on. They're predominantly about 30 plus proficiencies. They ask you each placement to achieve at least 15. And for anybody listening to this podcast, I can guarantee all of you at some point have read one of those proficiencies and gone, how the hell am I going to achieve that one? And Emma's just given you the perfect example of how to do that. You don't obviously have to produce all those proficiencies, but what a great way to self-educate and self-learn. And these people are readily available to help us learn these new skills. So yeah, if you want to get some of the more awkward ones ticked off your proficiency list, spoke day is it. Who wants to be next with a benefit? Harriet.
Oh, I was going to sort of combine the past two. I found that in the past, I was on placement and I couldn't tick off some proficiencies. And for this specific scenario, it was related with personal care. And so I'd been working a lot with dementia and looking at the theory of dementia in my other placement. And so to be able to go and do personal care and to tick this box, but also do it in a way that sort of enhanced my learning of what I was learning at my base ward. So you can combine the two of finding something really interesting whilst ticking off proficiencies. And I walked in there going, oh, I know a lot about dementia. I've looked at the theory, I've supported people in the past with it, and walked out of the dementia ward going, I know nothing. And so I think combining the two is a really good way to go forward.
One of the things I've experienced, and I think this might come to some of us, or maybe all of us, as the course continues, you start to realise where the gaps are in your learning, where you feel you want to sort of poke your toe into something a bit more.
Yes.
And I'll give you an example. I've always predominantly been in adult medical nursing side, so I know very little about mental health. So Actually, one of my first spoke days I ever did was with Emma, sitting next to me at the clozapine clinic down in Huntingdon, which was an absolute fantastic eye-opener. And one of the best things about that was that doing bloods was one of the major skills you needed to do in the clinic. So you're not only learning about mental health, but also getting the chance to practice a skill, which we all know at times we're all panicking a little bit of how we're going to get these skills, because when we get our pin, suddenly people are going to go, well, you're a Band 4 nursing associate now, you should know how to do these things. And again, there are opportunities, I believe, for you to get just more than just one thing out of going to do a spoke day.
And I'm going to agree with you there, actually, Noel. And that was probably my benefit, is if you have a particular interest in a certain area, that's your opportunity. Those spoke placements are those opportunities to reach out to these other departments, go and gain an insight to what's going on there. And I think for me, that's probably the best part about being able to do that.
I don't think I appreciated them till I actually went and did my first one. And I think there's an element of trepidation. There's an element of a bit of fear. You know, going to your own placement sometimes is hard enough, let alone sort of trotting off somewhere new and sort of going through that wonderful, it's like first day at school, you know, mum drops you off in the playground, pardon me, both father or mother could drop you off in the playground, and, you know, suddenly you're just in front of a load of people who don't know you. But actually, once you get your foot through the door, it gives you a lot of confidence to go and do a variety. I mean, I've clocked up 9 so far, obviously in areas that have a tendency to be more related to what I do in the community. So I've done podiatry, I've done the JET team, and for anybody who doesn't know what the JET team is in the community, they are like pre-hospital avoidance. So we try and go to patients' houses who have got some chronic issues, and we try and treat them in the community rather than send them to A&E, which is a great team to go and see, and quite specialised. So like what Alex was saying, and we've all mentioned around this table, there's some real niches in our trusts.
And I think as well, if you're working in a general ward and you have someone who has a common health condition and you've had that bespoke day, for example, for someone with a stoma bag, you'll just have a little bit more awareness of who to reach out to as well, and what charities are out there to be able to assist these patients.
You mentioned something. Now, there's a phrase that you might come up against, and it's called alternative pathways. It's a word that's bandied around a lot in the medical world, and it's exactly what Alex was touching on. The one thing you learn massively going to these different areas is how they all start to interconnect a little bit, because someone doesn't necessarily just have mental health. There's obviously some physical issues as well, or vice versa. Someone's got some physical issues and from that are getting mental health issues, and some people might have diabetes, which means they're going to have foot related problems, hence the podiatry. And before you know it, the more knowledge you have of how all these services interconnect makes you certainly exceptionally helpful, because I agree with you, Alex, that sticking to one thing, those 4 walls every day, will, I do think at times makes people quite insular, sort of within that.
Yeah, and I think...
Oh,
I
sorry.
think I think it's also a fantastic way to really take control of what's happening to you as well. So you're going out to these placements, and I think sometimes you can feel a real fish out of water. And actually, if you are finding it difficult on your placement, I think spoke days are a really great way to bridge that gap and say, well, I feel like I'm perhaps not learning as much as I could be here. Let me reach out and actually fill the gaps I want to fill. And I think that's a really key point of this course, taking control of your own learning, being proactive.
And taking control of your learning, I think, is a key element of maybe where some of us go wrong at the start of the university course. University is very different to school. School, they tend to say, this is what you're learning, we're going to teach you, listen. And at university, they'll very much sort of pose a question, pose you a few things, but there's a lot of self-directed learning.
Yes.
I mean, I struggle with the online, but I love the practical. And although we do have skill labs, when there's 30 of us in a room with all different abilities, those skill labs can sometimes